Hi everybody, welcome back to the Kidney Coach YouTube channel. I'm joined again today by an amazing Emily Cahill. Emily is a cardiovascular nurse. She has a special interest in oncology. She's a naturopath and she's also a very valid member of the Kidney Coach team. If you've headed over to kidneycoach.com and read any of our latest articles, you'll see her beautiful face under there. She's often writing and researching for us and commenting on your Facebook posts, as well as answering some of your emails. So Emily, welcome back and thank you again for spending some time with us.
Thank you for having me again.
Oh, no worries. I love having you on here because of course you, like us, live and breathe kidney disease. So we can have really good high level conversations about all things kidney and we can just get straight into it. I love it. So we wanted to talk today about polycystic kidney disease. Being one of the conditions that we know will lead to declined kidney function, but also there's some really cool research that's pretty recent that's come out with a couple of things that we can do that are having dramatic impacts on the size of the cysts that happen in polycystic kidney disease and shrinking them, which is really exciting because they're really easy to implement and are showing some amazing promise. So first off, Emily, do you want to walk us through what polycystic kidney disease is? How would someone know that they've got that, the symptoms, the etiology of the disease, and just anything else you think we need to know about what polycystic kidney disease is?
Sure. So polycystic kidney disease is a genetic disease that causes cysts to grow on the kidneys. So cysts over time can increase in number and increase in size, and if that happens, then basically it's like they're taking up parts of the kidney, so they're taking up normal kidney tissue, which means that eventually the kidneys can't work as well because they've got these cysts in place of their normal tissue. Generally, the kidneys will also increase in size with the cysts, so kidneys can end up weighing, quite a lot more than what they normally would because of this, which can then come with some pain and things like that. Generally, there's two different types of polycystic kidney disease. One is that mostly children are diagnosed with, or it can even be picked up prior to birth. But the more common one is autosomal dominant polycystic kidney disease, which generally doesn't get picked up till someone's sort of in their 30s or 40s. Symptom-wise can be pain, so pain particularly in the back or your sides, just sort of where your kidneys are. High blood pressure is a really, really common one. So particularly when younger people have developed high blood pressure, that's usually a bit of a red flag that kidneys are something that should be looked at. And then, other, symptoms of kidney disease, so blood in urine, having frothy urine, so protein, and also having a bigger tummy as well. And that's part of how big the kidneys can get.
Wow, so they even push or take up room of some of the bowel, so you're getting some movement of the bowel aorta and that protruding belly. Wow, there you go. They get quite big then, some of those cysts.
Yes.
How many cysts would say someone with a progressive polycystic kidney disease have, or is that, how many can you get there on kidneys?
Get up to like hundreds.
Yeah, right. I have seen some pretty gnarly ultrasound images of it, and it does look pretty crazy. So you obviously went through all the tests and the things that we can look at. So what traditionally would a nephrologist and Western medicine, how do they treat and what do they do for polycystic kidney disease?
Yeah, so generally speaking, it's more about managing the risks of kidney disease progression. So blood pressure is a big one, and obviously people with polycystic kidney disease are at higher risk for having high blood pressure. So that's something that would be managed. People with diabetes actually can have faster progression of polycystic kidney disease. So managing blood sugars in particularly diabetics is important.
Why is that? What is it about diabetes that speeds up the cyst formation?
Yeah. So what they've sort of, more recently worked out is that the cysts on the kidneys they use up a lot of glucose and they like glucose. So the more glucose that's available, the more they actually grow and the larger they get. So when people are diabetic, particularly if their blood sugar levels aren't controlled very well, they have more glucose in the body. So there's more fuel, I guess, for the cyst to grow. And then there's been, there's sort of some trials in terms of medications to help manage polycystic kidney disease. But generally what they've found with those is that the side effect profile is quite large. And because, polycystic kidney disease is a genetic disorder, it's something that people need to manage over their whole life, that having people on these medications long term can basically cause more trouble. So it's not really widely used.
So if someone was diagnosed, then really they're only using medication maybe in end stage, or if they've got maybe a fast progressive disease or something like that, would that be fair?
Yeah, even if then, it's more about trying to just slow the progression from, the Western point of view, with the view that dialysis or transplant are going to be necessary.
So polycystic kidney disease will definitely lead to end-stage renal failure and potentially the need for transplant and dialysis, as you mentioned. Do we know what's the sort of progression like? So say someone's diagnosed at 30, what is it really variable, or is there sort of a decline, like within 10 years you'll end up with?
Yeah, tends to be really variable, and I think part of that is that diagnosis can sometimes take a while, so it may not be picked up as being polycystic kidney disease until the disease has progressed a bit. So I guess part of it is how severe is the disease at diagnosis. But yeah, it does tend to be quite variable as to how long it takes.
And so is there anything else you want to say about, it's a big blowfly lands on my face. Anything else you want to say about polycystic kidney disease, or should we start talking about the really exciting stuff that we know is coming through?
Let's talk about the exciting research.
Let's get on to the exciting stuff, because it sounds like a miserable disease at the moment. I've got a couple of patients with polycystic kidney disease. So when actually Emily wrote an article for us on the web page, and I'd started to see some of the stuff about what we're going to talk about, but not all of it. And so I've got 2 patients doing very well, and I can tell you now that their cysts have shrunk with following what we're about to talk, and that's over a 6-week period. They've both had male and female, very different ages. One in her 60s, and the other one is he's mid-20s. Have both had quite a significant decrease in cystic formation and size. So without further ado, let's jump into, let's do fasting first. Let's cover that off. So why don't you tell us about some of that great research that's coming out about fasting and its impact on cyst formation? Yeah,
so they were doing studies in animals with polycystic kidney disease and sort of trialing different things, and they started off just by reducing food intake. So they reduced the amount of food that they had available, anywhere between 10 and 40% depending on the study, and they were finding that was reducing the number of cysts, reducing the size of cysts, reducing scarring of the kidneys, reducing inflammation, and all of these good things. And so at that stage they weren't quite sure exactly why it was happening, whether it was reducing a particular food or a particular nutrient out of the diet. So they continued, I guess, to do some studies, and they also had a look at intermittent fasting, and specifically time-restricted eating as well, which seemed to have the same benefits as just complete calorie restriction in the animals as well.
And do you think, a few things I want to ask here, knowing what we know about people with diabetes have an increase in polycystic kidney disease, and the cysts use glucose to grow. We obviously know in timed fasting and intermittent fasting and calorie restriction that you're basically making the pancreas work more efficiently, and that those insulin receptor sites work more efficiently. So you've got a better utilization of blood glucose and balancing blood sugar levels and things like that. Do they think that that's why they're shrinking, because you're basically working on insulin receptors and improving, insulin sensitivity and those sort of things? Is that one of the mechanisms?
So partly. So part of it they've sort of worked out is to do with the body being in ketosis, and the production of ketone bodies. So when we don't have, a surplus of glucose in terms of sort of coming in from the diet, our body then has to switch to make a different sort of fuel or energy. And what it does is it switches to breaking down fat, and it makes these things called ketones. And that's sort of where they ended up with the research, that it was the presence of ketone bodies. And the reason why that seemed to be beneficial in polycystic kidney disease is partly to do with the fact that they will use glucose, the cysts use glucose for energy and to grow. And also because in polycystic kidney disease, there's a certain signalling pathway that they realised was upregulated or overworking. It's called the mTOR pathway, so mammalian target of rapamycin. And when people go into ketosis, that's one way that we can quieten down or dampen down the action of mTOR. So when we're talking about medication earlier, one of the medications that they've tried to use in polycystic kidney disease is rapamycin, because it works on the mTOR pathway. And that was super successful in animals. And then they started using it in humans, and they weren't getting the same benefits. And they've realized the reason why is to get the equivalent dose of what they were giving the animals in humans was toxic. And it was creating a lot of other problems.
So here's something that I know a lot of our kidney people ask. Obviously, a ketogenic diet, which is a big craze, is quite high. It's very high fat and is probably quite different from what we would be telling our kidney community to eat, being that we want alkaline and high plant-based fruit and vegetables and things like that, which is very hard to get into ketosis doing plant-based diet. So can you just talk to, is it people suddenly have to switch to a ketogenic diet, or is it enough with the fasting and the time fasting that was producing enough ketones that was generating an effect?
Yeah. So yes, it was enough with the time restricted fasting. So that, I wouldn't recommend that people with kidney disease going on a ketogenic diet for all of the reasons that you mentioned. So the great thing is that you don't have to do that. With the time restricted fasting, created enough ketones over, the restricted time period that it had the same benefits.
Right. And the other thing that we know about time restricted fasting is it stimulates stem cell production. So we use it a lot in autoimmune diseases. So this is genetic, but if we're looking at IgA nephropathy, I was like, where did that disease go out of my brain? But, being a autoimmune disease of the kidneys, that we know that timed fasting is something that we might use in that because of the stimulation of stem cell production, which helps repair kidneys. So that's another great benefit. So let's walk people through exactly what time restricted is and how would they incorporate that into their day-to-day life. What does that look like?
Yeah, so it's about restricting the hours of the day that you're eating, which then means that you're increasing the hours of the day that you're fasting. So that's, the easiest way I find to do it, because while we're sleeping, we're all fasting. So we all do a version of time restricted or timed eating already. It's just about increasing that fasting window and decreasing the eating window. So whether that means eating, usually I tell people eat dinner a bit earlier and then push breakfast out a bit later tends to be, sort of an easy way to do it. But everyone's a bit different in how it sort of fits into their lifestyle, but that tends to be the easiest. So in the studies, particularly the one that was comparing the caloric restriction and time restricted eating, the animals were eating in an 8-hour period and then fasting for 16 hours. So they ate the same amount, they ate the same number of calories, the same type of foods as the other group. So it wasn't about the type of foods that they were eating, it was literally that they were doing it in a shorter period of time. Great.
And for anyone that doesn't know, this is how I eat. So I have been doing intermittent fasting for 2-3 years now. So I don't have any breakfast. I will eat my first meal. I have a shorter eating window because I'm really trying to pump out stem cells. But I will have my first meal between 12 and 1 o'clock, and then I don't eat again after 7 o'clock. So, and I use this a lot in autoimmune cases, which is what I see bulk of in clinic with fantastic results. But as I mentioned, I have 2 polycystic kidney patients in my care at the moment. One is a female in her 60s, and another younger male in very early diagnosis. He's in his late 20s, and both within 6 weeks have had a reduction, maybe 8 weeks with the older woman. That's just when we had the scans done. So that was pretty exciting. So I can tell you just from my experience, it works with those 2 patients that I'm working with at the moment. And of course, the best thing about intermittent fasting, times fasting, is it's free and it's easy to do, and anyone can do it. And apart from the benefits it has on the kidneys, there are so many benefits on time fasting. Emily wrote a great Facebook post. If you go back and have a look there, it'll be around the beginning of March, end of February, if I remember correctly, when we put that up, of 2021. And that goes through some of the benefits of that, but it goes beyond just shrinking cysts. It has a whole pile of amazing things. Did you want to talk about any of the other amazing effects that intermittent fasting has on the body and its relation to
I guess, big ones like reducing inflammation, reducing oxidative stress. So oxidative stress causes damage within our cells and our DNA and our organs, and also balancing out glucose levels, which is a big one. We know diabetes, yes, but even insulin resistant, or it increases the progression of kidney disease. So it can be really great for reducing glucose levels and balancing insulin.
Yeah, and like I say, it also stimulates stem cells, and some of the latest research they're finding is that our microbiome is what actually triggers our DNA. So our microbiome is very much, we know with epigenetics, it's the environment that signals the genes rather than the genes themselves. But they're now finding that the health of your microbiome very much talks to how DNA is switched on and off. And we know that intermittent fasting has huge benefits to the microbiome. It increases diversity, is my understanding, and you get higher butyrate and short-chain fatty acid producing bacteria in the gut with intermittent time fasting. And I think it was like 4 weeks of time fasting totally changed the microbiome. It was really amazing. And again, there's more and more research coming out about the importance of microbiome on the immune system and cardiovascular health and all sorts of things. So I don't think we've even scratched the surface of why time fasting and things like that are so important. So apart from that, there was something else that you found in your amazing research that was looking really promising for cysts. Walk us through what that is.
Yeah, so this was really interesting. So I spoke about the benefits of time-restricted eating is the production of ketone bodies, and that's how they think what ends up causing the cysts to reduce in size or stop growing. But they also found that giving people a supplement of one of these ketone bodies actually can have just as good benefits. So it's called beta-hydroxybutyrate, and it's something that when our body is using fat for fuel, we make that, our liver makes it. So I guess the way that they worked out it was beneficial is that they were measuring urine levels of beta-hydroxybutyrate in some of the animals, and they realized that the ones who were doing better had higher levels. So they found that if they didn't restrict calories, they didn't do time restricted eating, they just had the animals eating their normal diet but supplemented them with beta-hydroxybutyrate, it had basically the same effects as going into ketosis. So it reduced the size of cysts, reduced the progression, reduced the scarring, inflammation, and after 5 weeks, the treated animals with polycystic kidney disease, their kidneys looked exactly the same as the animals who never had polycystic kidney disease, and that's only 5 weeks.
5 weeks of a supplementation of hydroxybutyrate, and they normal kidneys.
Yep, normal kidneys. Better
Have
kidney
they
function.
done trials yet?
They're doing them at the moment.
You'll have to keep us posted on that. That's for people with polycystic kidney disease. Potentially, they've found a cure, which is so exciting, and I don't get too excited about medical frontiers, but that's super exciting. Of course, it's a supplement, which means, you know, 5 weeks to reverse. It's something that you can either do yourself through time fasting. If someone wanted to get hold of that, where can they get that as a supplement?
Yeah, so it can be purchased online. So it's widely available. A lot of it's, I guess, marketed as a weight loss supplement. So I guess that's one thing to be aware of. It doesn't mean if you take it, you're going to lose weight. It's people when they're doing the ketogenic diet and doing it for weight loss, and that's sort of the way they market it. So don't be concerned if you don't need to lose weight that you're going to take it and that's what's going to happen. That's not the case. One thing though to be aware of is that a lot of the supplements, so it's made with different salts, so it can have potassium in it, sodium in it, calcium. So just, be careful of which one you're buying, depending if, you do have elevated potassium levels and you need to be limiting that. Just be aware of the full, I guess, ingredient list and choose one that doesn't have high levels of something that perhaps is not going to be very beneficial.
What dosage range were they using, do you know, in humans, or is there a gram per kilo? What sort of dosage does people need to get that same sort of potential outcome that they were getting in the mouse studies?
I can't remember.
Okay, that's maybe something we can put in the show notes, but I'm wondering whether it's just a standard dose of what would be on the packet or whether they were using a higher dose.
Yeah, no, I think because when I prescribed it, I just used a standard dose. So yeah, the studies weren't using particularly high doses.
Cool. It's very exciting. So very exciting stuff for people with polycystic kidney disease. I'm excited for that population, and that's one less population group where we can prevent the progression of kidney disease and end-stage renal failure and, kidney transplant by simply doing some timed dieting and maybe adding some ketone bodies into in a supplement form. That's pretty amazing. So natural medicine and those sort of things never cease to amaze me. So anything else that we need to add about that, Emily? Anything else you want to say to the polycystic kidney disease family, or supplementing? Anything else they should be doing on top of, along with?
I guess just, all the usual things we'd recommend for kidney disease: alkaline diet, managing blood pressure, supplementation to help with healing the kidneys. Yeah, all of those, I guess, normal things. I guess, particular flag for people who do have diabetes and do have polycystic kidney disease to really be on top of your blood sugars and to really manage that well so that, it's not increasing the growth or the progression.
Yeah, for sure. Well, fantastic. We'll put we'll get that study into the show notes for you guys. Remember to hit subscribe so you'll get notified whenever there's some new content on the YouTube channel. And if you haven't already, head across to kidneycoach.com. There's an article there that Emily's written on polycystic kidney disease, and I know there's an article coming up that she's probably in the middle of writing in the next couple of weeks or so that will actually cover this in details, and we'll probably add this video to the bottom of it so you can have a look. But yeah, we thank you for listening and joining, and exciting times for those with polycystic kidney disease. Hopefully we can one day sit and have a video chat about a full cure for kidney disease that will help as well. So take care, everybody. And again, thanks for listening, and we'll see you next time. Thanks again, Emily. Appreciate it.
Bye.
No worries. Bye.